Hello dear students, how are you? Uh, as a continuation of vital signs, we are going to see about pain management in detail because there is a separate chapter dedicated for pain management in your book, and this is going to be an important topic for you, maybe throughout all your courses. Like it is important in child health, maternal health, and adult health, nursing. Everywhere the pain is going to be an important topic. So we will spend some time in understanding the mechanism of pain and how do we assess the pain and how do we manage pain, things like that. Okay, so the objectives will be, we are going to understand about the nociceptive and neuropathic pain categories. Okay, four processes involved: gate control theory, and then how do we take care of these patients. Okay, as we all know, pain is an unpleasant, highly personal experience. Okay, nobody likes to have pain. Even if we want to get small injection, we don't like it because it is causing pain, and it's unpleasant sensory and emotional experience also. And sometimes it is actual tissue damage or damage which is going to happen. You will have the pain before that, and others may not be able to understand it, may be imperceptible to others. How I feel, you cannot understand. So it is not just a symptom, it's a high priority problem. That's why we have added pain as the fifth vital sign. Okay, and how do we manage pain? Alleviation of pain or reduction of pain to a level of comfort that is acceptable to the patient. Okay, this medication I have given, this should be enough. That should not be our attitude. How patient is feeling after I give this much of medication. Maybe he needs more or he needs lesser. That is very important. And persistent pain, if we are not taking care of it and if pain is continuously there, it can contribute to complications. They can get emotionally upset and it can cause many other problems which they cannot come out of. And there are some definitions which are given by International Association for Study of Pain. It is a privately experienced unpleasant sensation, usually associated with a disease or injury. So mostly whenever we have some disease or injury, uh, we can feel the pain. And pain is, it is whatever the patient experiencing person says it is. Okay, so it is more subjective, what he feels. It's not you who deciding. Okay, it is the person who should say, when he's saying that there is pain, there is, you cannot deny that. Okay, and we need to go according to that report, that symptom. Okay, and it is considered to be the fifth vital sign, which we already know. And it's very important. It's a protective mechanism or a warning which is going to happen inside our body. Something like, for example, if there is a chest pain, we know it is patient is going to get heart attack. If there is a pain in the right lower abdomen, there can be appendicitis. Okay, there is inflammation of the appendix. It can rupture. It can cause bigger problems. So it urges the person to take proper treatment so that there is a major damage which can be prevented. So it's a good thing. Pain and the presence of injury may help to prevent further injury. So whenever there is maybe some fracture, the bone is broken, because there is pain, we go to the hospital, we take treatment so that there is further problems are avoided. What are the different types of pain? We can divide pain based on duration, location, mode of transmission, etiology, the cause and the intensity. Okay, so if we see that based on the duration, you can call it as acute pain or chronic pain. Acute pain is which happens suddenly. Okay, within seconds it comes, and it can last even for weeks or months or up to 6 months. Okay, it is associated with specific injury, some cut, some wound, or some fracture, we can say like that. And it decreases along with the healing. As healing is occurring, the pain also decreases. What is chronic pain? It can last for more than 6 months or years together, you can have pain. It is constant. Sometimes it is intermittent. Like for example, back pain. It is when you're doing lot of work and things like that, you feel the pain. Otherwise, you're fine. Okay, and it persists beyond the expected healing time, and very difficult to treat because you don't know where exactly is the pain. Sometimes it is on the right side, sometimes on the left side, sometimes the whole back. Okay, so chronic pain is very difficult to treat, and patients with cancer and some of these chronic diseases also, they have chronic pain. And based on the location, if it is in the skin, okay, it is a sharp burning pain. If the origin is in the skin or subcutaneous tissue, it is on the surface of the body, it is called cutaneous pain. Okay, visceral pain. What is visceral? Inside the area in the thoracic cavity or in the abdomen or in the skull. Okay, pain which is inside, it is called visceral pain. This also poorly localized. We do not know. Everywhere it will be paining, but the problem is with the stomach. Okay, so that is very poorly localized. And somatic pain. Okay, somatic pain also in the deep structure, but mainly muscles, bones, and joints. Okay, based on the cause. When the nerves are affected, we call it as neuropathic pain. So commonly it is seen in diabetic patients, their peripheral nerves are affected. So because of that, they have severe pain in the legs. And there is one more pain called intractable pain. Though you give treatment, the pain is still there. Okay, that is called the pain which you cannot treat. It's called intractable pain. The third one which I'm saying is very important, phantom pain it's called. You know what is this phantom pain? Okay, a person who had a major accident, okay, he has lost his leg. There is no leg at all for him. Okay, but when he's there in the hospital, he's still on treatment, and amputation means cutting, removing the leg. Okay, so what happens? He's not able to accept because it happened suddenly that he lost his leg. So he will be complaining, I have severe pain in my foot. See, there is no leg, but he's complaining of pain in the foot. So it is more of psychological, and we need to really take care of it. We need to reassure them. We need to treat. Sometimes medications are used to treat this pain. So please remember phantom pain. Phantom pain uh, after amputation. There is no leg, but they still feel the pain over there. Then psychogenic pain. There is no physical cause. You do ultrasound, you do everything and see abdomen is fine. But the child is saying severe abdominal pain because he doesn't want to go to school. He wants to take leave. Okay, so there can be psychogenic pain also. And based on the intensity means severity. Okay, if there is no pain, 0. If they rate from 1 to 3, you call it as mild pain, 4 to 6 moderate pain, 7 to 10 severe pain. Okay, so based on the severity, we can divide them as mild, moderate, and severe. What are some of the factors which are affecting pain? Okay, socio-cultural factors play a major role in many cultures. Okay, when you talk about pain, people don't like it. You have to be silent. You have to be accepting it. Okay, so only some gestures or some facial expressions you are allowed to show. You are not allowed to shout and scream. In some cultures, they only scream and express it and do things like that. Okay, so there are a lot of cultural variations when it comes to expressing their pain. And when we come to age, we always think that children cannot feel the pain, which is not true. Now this topic is gaining very important in the later days. They are trying to do a lot of research to understand the pain which the children are feeling. Of course, they express it by crying and things like that. Okay, and gender. How gender is different? This is not me, unfortunately. It is the research evidences which are showing that female are expressing higher levels of pain. and some of the problems like headache, back pain, and all those things are expressed by females more. That is what the research evidence says. And meaning of pain. See, meaning of pain is very important. When I can understand that because I have this disease, I have this pain, then I can understand, I can adjust with it for some time. I can cope up with it better. Okay, so meaning of pain also is important. It may mean different things to different people. And sometimes when this anxiety, psychological pain also is experienced by the person. And then the past experience with the pain. Okay, you have seen, for example, a delivery pain. You have seen one of your relative during the delivery time, how she was suffering. So when it is your turn, you're also anticipating it and you're worried about it, or you already knew it, so you're able to cope up better. It can be both. And then expectation and placebo effect. Most of the times, pain is controlled with placebo effect. Okay, it may be just a vitamin tablet, but you say that this can reduce your pain and give it to the patient, especially for psychogenic pain. It is really helpful. Placebo means not the real medicine, okay, which is for reducing the pain. When it is psychogenic pain, why do you want to give real medicine? So you can give a placebo effect, that is just to say give a medication, but it is vitamins or some simple medication, okay, but it's not for pain. So such things can affect, these are the factors which are affecting pain. Okay, I want you to look at this closely. I know you have already learnt about it in an anatomy physiology for the process which are involved in feeling of pain. Okay, what is the first step is called transduction. Okay, what is transduction? Transduction is nothing but the where, see, you're seeing in picture 1, there is a nail which is coming and piercing. So where you're able to feel the receptors which are there in this skin are activated to get the stimuli. Okay, it can be mechanical, chemical, thermal, any of these things, heat, okay, or pressure or pinch, any of these stimulus which are coming over there, the sensors which are there in the skin are taking it up. That step is called transduction. The second step is called transmission. So from there the signal is traveling up to the spinal cord. Okay, and then from spinal cord it goes to the brain. Okay, when it goes to the brain, the person is aware of the pain, conscious of the pain. It is called perception. So there is transduction, there is transmission, and then perception. Okay, after it reaches the brain, there is a message which is coming down. Neurons in the brain send signals down to the spinal cord to release some substances that can inhibit pain. Okay, that step is called modulation. Okay, we have some substances which are already in our body which are acting as narcotics, which can reduce pain. After that, if they also cannot manage that, then only we are able to feel that pain. You understand? So we are aware of pain, but some modulation takes place in our body. So we are not suffering with that pain. But when it is beyond the capacity, we feel it. Okay, so some of the types of painful stimuli, mechanical, thermal, chemical, all that I have given over here. Okay, I want you to understand one more concept. Okay, here we are seeing transduction, transmission, pain perception, modulation. Okay, one more important thing. Do you see there are two different types of fibers which are going from the transduction, from the sensors. Okay, A delta fibers which are transmitting sharp localized pain very fast. Okay, C fibers, they transmit the painful stimuli very slowly, slow transmission of dull, burning, chronic pain. Okay, there are two different type of fibers. So when they are going to the brain, we can see what are the changes they are making. Okay, that is what is called as gate control theory. Okay, what is the gate? When it is the large diameter fibers, okay, see it clearly. When large diameter fibers are going, the gate is closed. Second picture. Okay, when small diameter fibers are going, the gate is opened. Okay, so based on this, this is called gate control theory. Gate is in the spinal cord. So when small diameter fibers, that is uh, peripheral nerve fibers, when they carry signals of noxious stimuli. Noxious means painful stimuli to the dorsal horn. Signals are modified when they are exposed to substantia gelatinosa. Okay, so the ion channels on the pre and post synaptic membrane serves as gates. When open, they permit positively charged ions to rush into the second order neurons, sparking an electrical impulse and sending signals of pain to the thalamus. Large diameter fibers have an inhibitor effect. Okay, so when it is small fibers, the gate is opening and it can go inside. When it is large diameter fibers, okay, they have an inhibitor effect. So the patient feels pain in a lesser intensity. Okay, so based on this, we want to introduce this non-pharmacological management of pain to the patient. So, according to this gate control theory, what is the clinical application? The nociceptor. Nociceptor means the painful stimuli firing by treating the underlying cause. Okay, so when it is there in the skin level itself, when it is there in the sensors in the skin itself, we can apply some local therapies like heat, cold, okay, tense, massage, so that the fibers will not travel over there. Okay, there is one more thing, address the client's mood. So you reduce the fear, anxiety, anger, provide education and anticipatory guidance. Okay, so psychologically also you can take care of their pain. Physically also you can take care of their pain. I'm not going into detail of this because I have given this as an assignment for you to work on it. This is the non-pharmacological management of pain. This is based on the gate control theory. Okay, how do we assess the pain? The first thing you will find over here is patient self-report. We saw in the definition, whatever the patient says, you take it. You don't decide. The pain should be only this much. The pain should be only this much. Okay, if the patient says, my pain is very severe, you consider it as very severe. Then it can be from the family member, and non-verbal behaviors, you will see some of them crying or keeping the face like this, holding that area, things like that. Then physiological measures. We saw already whenever there is severe pain, heart rate increases, respiration increases, BP increases. Okay, so we can see some physiological changes, and we are going to assess pain with the help of PQRST, just to remember it very easily. Okay, P means provocation or palliation. What is provocation? What are the things which increase their pain? For example, you are complaining that you have severe headache. So what could be the reason? Maybe last night you were sitting and studying for the exam. You did not sleep properly. What is palliation? Okay, now I feel that the headache has reduced little bit after I took a coffee. Or you're saying I took one Panadol. So how could you reduce that pain for you? Okay, then quality of pain. Sometimes it is very sharp, sometimes it's burning, sometimes you say it is dull, I cannot localize where is it, the whole head is aching. Okay, and the region and radiation. What is region? Where is the pain? Okay, radiation, where all it is extending. See, sometimes you will say my pain is in the right side, but it is not only in the head, it goes to my neck, it goes to my hands also. Okay, so where all it radiates. Radiates means where all it is spreading. And severity. You are going to, next picture I am going to show you. we have something called pain scale. So from 0 to 10 numbers are there. So the patient can rate severity. My pain is 8, my pain is 7. So we understand the severity with the numbers. Okay. And T is timing. Timing means when the pain started, how long the pain is continuing. Is it continuous, or morning it was there, then there is no pain, afternoon again it increased, things like that. Okay. And pain management history. In the past, like this, when you had pain, how did you manage? Did you take only coffee, or did you take some medications, or those things also will help us to manage the patient better. Okay, what are some of the effects of pain? Pain has physiological effect and behavioral effect. Okay, the physiological effect I already told you, it increases BP, respiration, pulse rate, the patient becomes pale, sweating. Diaphoresis means increased sweating, and pupil dilation can occur. Behavioral, the patient can make some noise, like that, or crying, or the face is clenching the teeth, and the face is not normal, it is dull. Okay. Or they are not moving in from one place because it's severely painful. And if I have pain in the abdomen, I'm holding my abdomen and sitting. Okay. And they don't want to face anybody, they don't want to talk to anybody. Okay, pain assessment tools. We have many tools. There are some which are called as unidimensional tools. There are some which are called as multidimensional tools. Okay, numerical rating scales. Numbers are there, and face rating scale. Why face rating scale? Children sometimes cannot read the number, or if they have not studied, if they are not educated, they cannot read the number, but by looking at the face you can decide the number. Okay, I'll show that picture next. Multidimensional, there are so many tools which are questionnaires which are available to assess the pain, but I feel the best uh, multidimensional tool which you can access very easily is PQRST. We already saw about it. Okay, so we will be seeing it in the lab also. We are going to use it in the laboratory. We will teach you how to use this PQRST to do pain assessment. Okay, these two are the scales which I said. The first scale has got number, so we call it as numerical scale. No pain, 1 to 3 is mild pain, 4 to 6 is moderate pain, then 7 to 10 severe pain, 10 could be worst possible pain. Then this face scale is called Wong-Baker scale. Okay, see, you see the face, the baby is smiling, that means no pain. Okay, when it comes to uh, 3, hurts even more, you can see the face like this. Okay, the pain is 6. If you see in picture 10, the pain is 10, where you see the baby is crying. Okay, so we decide the pain with the help of the pictures. Even mentally challenged people also, we can use this scale. Then what are the nursing diagnoses we are going to write? Mostly it is acute pain or chronic pain, okay, based on the duration of the pain. And what are some of the strategies in pain management? First, you should acknowledge and accept when patient is saying there is pain. Okay, you should never say, no, no, why this small problem will cause pain? No, never say like that to a patient. And assisting support persons. And you should reduce misconceptions about pain. Okay, and reduce the fear and anxiety, and then try to prevent patient getting pain by using non-pharmacological management in the beginning itself. Okay, relaxation, imagery, massage, laughter therapy, heat or cold applications. I'm not going to explain about non-pharmacological management. I think each one of you are working on the assignment and you will be able to do it in a better way. And what are the pharmacological management? That also I'll come to it. We have a WHO ladder, with that I will explain it. Okay, some of the drugs which we can use, non-steroidal anti-inflammatory drugs. The best example is acetaminophen, that is the Panadol which we take, isn't it? So it is the mild form of drug. Okay, it actually this is the best analgesic which we can use. We would have heard about Oberon also. Okay, common one. Diclofenac sodium they call it. Okay, the next level is opioids or narcotic analgesics. They act on the central nervous system, so it can cause some sedation, some sleep effect also. So when the pain is very severe, like after surgery or some accident, we need to give opioids for the patient. Okay, I'm sure you all would have heard about sickle cell disease, which is very common in Oman. So many of these patients, we need to give them narcotic analgesics like morphine. And then there are some adjuvants. They don't directly take care of the pain, but they can help in reducing their fear and anxiety. So antidepressants and anticonvulsant drugs we are giving. Then as I told you about placebo. Placebo is not real medication, but like a medicine, just to cheat, like we are cheating the patient. For example, if the patient is having some psychogenic pain, psychological pain, okay, we cannot be giving medications and there will be side effects, it will be harmful for the patient. So we just give them a sugar pill. It looks like a medication. So the patient understands, okay, because I have taken medication, my pain should reduce, and it really reduces for them. And then instead of giving real injection, we just give some normal saline injection. But they feel they are relieved from the pain. That is called placebo. Okay, this is a very important PowerPoint. I want all of you to remember this. This is called WHO. WHO, all of you know, World Health Organization has given a 3-step analgesic ladder. What is analgesic? Analgesic is medications which are used for pain relief. Okay, so when the patient is feeling the pain, the first step of the ladder, first step, you are giving only non-opioid medications, that is like Panadol, and some adjuvant therapy. Adjuvant means, okay, you give non-pharmacological, some massage or some heat or cold application also. Second step of the ladder, when the pain is increasing, you started with Panadol and you started with some massage, but the pain is increasing, so you go to opioid. Okay, opioid is morphine. Then when we go to third level, you tried with all these things, okay, and it is not reducing. So you can start with more or higher dose of opioids. Okay, all these three things together you can have in the ladder 2, sorry, ladder 3, okay, the higher stage. And when we are giving adjuvant, non-opioid, and then opioid, and also continue with all other therapies also, the mind diversion, distraction from the pain. Like if you go and keep talking about pain only to the person, they will start feeling it more. So you need to divert their mind by talking about something which is very pleasant for them. Things like that will come under non-pharmacological management. That is called adjuvant. Okay, and this WHO ladder is mainly given for patients who are with cancer pain. Okay, so they have freedom from the cancer pain. What are the ways of administering of drugs? Okay, we are administering drugs. The just easy methods are there. Okay, whenever the patient is in pain, whenever the patient is asking, this is the traditional method of treating pain. Okay, so there is order which is written every 4 hours, every 6 hours you need to write it and they take it. And the second method, which is very new, is called patient controlled analgesia. We call it as PCA. You know what is patient controlled analgesia? And this patient, especially, I said about cancer pain, I said about sickle cell disease. Such patients, we give a small button in their hands which is connected to the medication. Okay, medication is connected to them, but they have this small, like a remote in their hand. Whenever they feel severe pain, they can increase the dosage of medication for them. When they don't feel pain, they can stop. the medication which is going inside into their body. This is called patient controlled analgesia. This seems to be working very well, and we can find it in many of our hospital settings. Patients are provided with this type of this route of medication. Then of course oral route, so it is administered as tablets or syrup. Then intramuscular route, when you give injection in the muscular region rapidly, within 15 minutes the pain reduces. And then faster than that is intravenous route, through the veins. When we are giving medications, immediate relief they have. Then it can be administered through the rectal route. People who cannot take orally, for children, Panadol and all can be given through the rectal route. And then transdermal route. There are some patches like a sticker. It is put on the skin of the person, and this medication delivers small amount of pain analgesic throughout the day. Okay, it can be there for 48 to 72 hours. Then transmucosal analgesia. It can be given under the tongue or orally by means of lozenges or lollipops for children. Okay, pain medications there. And then continuous subcutaneous analgesia, usually during labor, delivery pain, and some of the surgeries, they put this tube inside the epidural region, and continuously small amount of analgesia is given for them. Okay, that's all I have for about pain and pain management. This non-pharmacological pain management strategies, after I hear from group 1 and group 2 how we are discussing about it, I may explain, or I may conclude it with the help of PowerPoint later. Okay, or if you have any doubts, I will clarify it after I read all your points in the assignment. Okay, to summarize, as I said, pain is a subjective sensation. It is different for different people. So, type of pain may be described in terms of location, source, duration, intensity. The most reliable indicator of the presence of pain is client's self-report. So, pain management include non-pharmacological and pharmacological management. It is going to be a very important topic when we go to the hospital in adult 1, adult 2 and all. When you see patients, really you will see them suffering with pain after surgery or in cancer, things like that. So it is very important for us to know how to assess these patients and how to relieve their pain with medications and without medications. Okay, thank you.